Thank you, Acting President. I will be brief. Before we found ourselves living in this dystopian police state, back in the before times, the government actually did achieve a few good things. Last term, we saw the first tentative steps on the long road of drug law reform. While the government didn't go as far as recognising that our drug laws were terrible, they did at least recognise that they were restricting people from accessing products with a significant therapeutic benefit. It shouldn't have taken so long or have been so hard, but they did legalise medicinal cannabis products, and this was clearly the right thing to do. It's pretty hard to argue with parents of sick children telling us that it has saved the children's lives. If this government finds the courage to take more steps on the path of drug law reform, we will back them. Unfortunately, in addition to our terrible drug laws, we also have terrible drug driving laws. Laws that the government has recently announced changes that make things even worse. The pandemic has shown us some of the issues with centralised planning and an over-reliance on experts with a myopic view of success. This is also true in our drug driving laws, which are harmonised across Australia thanks in part to the National Drug Driving Working Group. The key issue with our drug driving laws is that they don't test for driver impairment, they only test for the mere presence of an illicit substance. With cannabis in particular, this can mean that someone can consume cannabis, whether it's a legally prescribed product or not, on a Friday night and be tested at a random drug testing operation on a Monday and lose their licence. To call this justice makes a mockery of the concept. The reason our drink driving laws work is that they are widely perceived to be reasonable, evidence-based and just. That isn't the case with our drug driving laws. In order to have effective laws, we need the support of the community. When laws have no credibility with the public, no buy-in, they will be ineffective. Despite the apparent belief of some in this place that laws can and should be enforced at the end of a truncheon, that kind of thing only works in a dystopian police state, and even then, not very well. While the bill before the House today will not rectify this situation, it does improve it. The National Drug Driving Group states in their 2018 report that the goal of the policy approach is to get people to separate drug use and driving. For people consuming cannabis that may stay in their system for days, there is no reasonable way to comply. For people who have only been able to function in society through the use of medicinal cannabis, the situation is worse. They have to choose between health or mobility. And even worse for people in the regions, like Northern Victoria, that have less access to the public transport options. If you lose your licence in the regions, you lose your job, you lose your life. Ms Patten's bill proposes a very simple and sensible reform to treat medicinal cannabis patients the same as people that use any other medication that may impact their driving ability. If we accept that cannabis can be used as a medicine, and we clearly do, it's a legal medicine, then it should be treated like any other medicine. Victoria's drug laws are bad. Anytime this government or the opposition, should they ever stumble towards supporting individual rights over conservative nonsense, or anytime any of our crossbench colleagues can gather together the courage to propose changes that will make our terrible drug laws better, the Liberal Democrats will support it. Every bill, every motion, every time. I congratulate Ms Patten for bringing this to the chamber. If passed, it will be one more small step forward towards better drug laws. The Liberal Democrats will support this bill.